Yeah. So thank you for the introduction. Raghadirogan, Satatanushaktan, Asheshakayan, Prasritanasheshan, Autsukya Moha Ratidana Jagana, Yopuro Vaidhyaya Namustutasmai. My humble pranamas to the lotus feet of Lord Dhanvantari and Jagadguru Shri Shivaratri Deshikendra Mahaswamiji, as I am working in JSS Ayurveda College and Hospital. Am I audible?
Audible, madam. Audible.
Audible.
Yeah. At the outset, I would like to thank Nanjunda Swami sir, as he has invited me as a speaker in this short-term course on Indian knowledge system. So let us have a brief regarding the fundamentals aspects of Ayurveda. Okay. So first, let us see what is Ayurveda. So you may be knowing this science of healing or science of life. Some may not be knowing, but at the time of COVID, you might have heard like there are so many remedies for the respiratory illness and other complications which happen to be due to the COVID. So I think all of you are aware about Ayurveda. So now let us see what is Ayurveda. It's a science of life. It's a Upaveda of Atharva Veda. So we have Samaveda, Rigveda, Yajurveda, Samaveda, and Atharva Veda, the 4 Vedas, out of which the Atharva Veda, Upaveda is the Ayurveda. So nearly 5,000 years ago, it was written in the form of treatises, that is, books in Sanskrit, by the sages having pure supreme knowledge, intelligence, and wisdom. See, Ayurveda deals with the measures to protect the health of an healthy individual and the management of diseased conditions. So it has both. One is the treatment of a diseased person, and the second is the maintenance of health of a healthy individual so that he should not fall sick. About the origin of Ayurveda, the history, it is from Vedakala. So what is said in the science or the treatises is that it is the smriti of Brahma. Brahma smritva yashurvedam prajapatim atigrahat. So Ashwinautau sahasraksham, so Atriputradikan munin. This is the origin, how the Ayurveda is brought into the world. Like it was recited by the memory of the Brahma and later to the descendants. So one after the other, it was taught in a Ashwini, Atriputra, etc. So after that, these personalities or the sages, they have written the Ayurveda as in the form of a textbook. So that is what called as Samhita Kala. Samhita Kala, the era of the textbooks wherein the Charaka, Sushruta, Vagbata, Bhela, Kashyapa, Harita, they are all the authors. They are all the authors and the doctors, what you call. So they have seen the patients and the healthy individuals, and they have written, so what best can be done to improve the health, what best can be done to treat the patients. So all these were written as a document in the form of Samhita, the treatise, by these acharyas. So we call it as Samhita Kala. So next comes Sangraha Kala. So this is little bit easier form of their versions, because there are so many samhitas or so many books. So it becomes very difficult for an individual to go through all the books, because it is the science is so vast that one life is not sufficient enough to understand what they have explained and how to explore and how to implement these things in a person who is healthy or a deceased individuals. So what the next Sangraha Kala, the Acharyas, they have done the compilation of 2-3 books, and they have added their version of understanding of Ayurveda and have written next set of books like Madhava Nidana, Chakradatta, Vangasena, Rasaratna Samuchaya, Bhava Prakasha, Yogaratnakara, Vaishajya Ratnavali. See, these are all the textbooks. Not only these many things, there are innumerable. You can call so many textbooks they have written. So it is for the utility of the further the era people. So now we are in the Adhunika Kala or the modern Yuga or the era. So wherein we need to understand the Ayurveda science as a whole, and we need to explain those who are asking, that is, what is Ayurveda, what is said, how can you say this is that? Like there are hundreds and numerous questions. So we need to understand Ayurveda as a whole, and you should able to get the knowledge to such an extent that which can be explained in the language of modern science also. So that is what is the modern era, where the Ayurvedic concepts and the treatments can be explained in the modern terms. So these textbooks, then how can you say what is said in Ayurveda is considered to be Trikala Satya. So if you go through a journal, the articles, the modern journal and articles in that, if they say like this is the one which causes cancer, 6 cups of tea causes cancer is one article. And after 5 years, another person says 2 cups of tea will protect the person from cancer. Like this is, so it gets changed every some 2-3 years. The things gets changed, but such is not seen in Ayurveda. So what is said in Ayurveda is Trikala Satya. It is true for the past, present, and for the future. Why? Because these are the knowledge, so which are given by our sages. So they are considered to be aptas for us. Then what is apta? It is said, Rajastamobhyam nirmukta tapo jnana bhalenaye yesham trikalam amalam jnanam avyahatam sadha apta shishta vibuddhaste tesham vakyam asamshayam. That is, aptas are those, though they doesn't have rajas and tamas gunas of the manas, because sattva is considered to be the topmost guna of mind. So when they don't have rajas and tamas property, whatever is said becomes Trikala Satya. And asamshayam, what is said is, it doesn't have any doubt at all. Satyam vakshantite, they always say the truth. Kasmada satyam nirajastamaha, they never say the asatya or the wrong or the things. So satyam vakshanti, what is said in Ayurveda is Trikala Satya, or it is true for all the 3 kalas. Now the definition goes like this: hitahitam sukam dukkam ayustasya hitahitam manancha tacchayatroktam ayurveda sasa uchate. Means it is a science of life wherein we can see the description of hita and ahita ayu, sukha and dukkha ayu. Then manancha taccha, so the measure of that, all these are explained in Ayurveda. So what is hita to the body? What is ahita to the body? See, what is sukha and what is dukkha? See, hita is, see, if a person sleeps in the daytime, then it may be sukha. The person may feel comfortable, but it is ahita for the body. What is sukha may be ahita. So some person may be interested in eating pizza, burger, etc. It is giving sukha to the tongue. But once it gets digestion, it becomes visha in the body. It becomes ahita and dukkha ayu. So as a result, what is sukha, what is dukkha, what is hita, what is ahita to the body, and how much it is sukha, how much it is asukha. So with the measures, it is explained, that is called as Ayurveda. Then there are 2 mottos. There are 2 mottos for the Ayurveda. That is Swastasya Swasthya Rakshanam and Aturasya Roga Prashamanam. Swastasya Swasthya Rakshanam means the healthy individual should live long with health, because as the day passes off, the person starts developing the varieties and varieties of diseases. So how to maintain the health of a healthy individual? And aturasya vikara prashamana, if a person is diseased, how to treat? So both are dealt in the Ayurveda. That is why it is preservance of health of healthy individual and cure the sufferings of the sick. So why this Ayu or Arogya? What is the necessary of having Arogya? It says Dharma Artha Kama Mokshanam Arogyam Mula Uttamam. That is the four aims of life. That is Dharma, Artha, Kama and Moksha. I think all of you know the meaning of these four aspects. So for the complete salvation, Dharma, Artha, Kama, Moksha, so one should have the Arogya. If the person is a rogi, if a human is a diseased one, then he cannot achieve the Dharma, Artha, Kama and Moksha. The complete achievement of the goal of the life is possible only with the health of an individual. That is why if health is there, everything is there. And if health is not there, everything is a waste. Then what is a living being? Ayurveda says, Sharira Indriya Sattvatma Sanyoge Dari Jivitam. Who is human? What is life? It says it's a combination of Sharira, that is the human body, Indriya, the senses, Sattva, that is the mind, and Atma, that is the soul. A complete conglomeration or a combination of Sharira, Indriya, Sattva and Atma Sanyoga is called as a Jivita or the life. Sattvatma Sharirancha Trayametat Tridandavat Lokastishtati Sanyoga Tatra Sarvam Pratishtitam. That is the Sattva, Atma and Sharira. The three are considered to be like a tripod of a person above which the person is standing. See, these are the kambas. If the pillar of this is abnormal, if the mind is abnormal, if Atma is abnormal, if Sharira is abnormal, then health will be abnormal. So these are the three pillars of life. All the three should be solid enough to have a good health. So lokas tishtati sanyogat tatra sarvam pratishtitam. Then the Ayurveda defines what is health then. It says samadoshaha samagdishcha samadhatu malakriyaha prasanna atmendriya manaha swastha ityabhidiyate. That is, the person should be having dosha, dhatu, mala, agni. So these are the major four concepts we concentrate while the person we are treating the patient. Dosha is what you call Vata, Pitta and Kapha. They are considered to be the three doshas. Dhatus are the tissues of the body, like Rasa, Rakta, the blood, Mamsa, the muscles, Meda, the fat, Asti, the bones, Majja, the bone marrow and nerves, the Shukra is a semen. So these are considered to be the 7 tissues. And Malakriyaha, the urine, the motion, the sweat, all these. See, all these, the functioning of these things should be very, very proper. Then only, that is why you may be knowing that the person gets investigated. You say the complete health checkup, executive health checkup. So the liver scan, the X-ray of the chest, and the urea, creatinine for the kidneys, and muscles, the X-ray. So mind, the brain scan, etc. See, all these things are done to see whether these activities in the body is normal or not. Prasanna Atma Indriya Manaha Swastha Ityabhidiyate. It is not sufficient that all the functioning of the body is sufficient enough to call to be as a health. Prasanna Atma, Prasanna Indriya, Prasanna Manas. The person should have a happy mind. If he is under grief, sorrow, anxiety, depression, then he is not called as a healthy individual. So Prasanna Manas, Prasanna Indriya, all his Indriyas or the sense organs should work properly. And Atma, the Atma or the soul should be very pure. If it has come with attachment of the karmas, then past life karmas will present the patient, present the person with the new diseases in this life. What do you call it as? The hereditary diseases or a genetic disease So many are there which are attached with the past life karmas. So that is why Ayurveda defines health as samadosha, samagdishcha, samadhatu malakriyaha, prasanna atma indriya manas, swastha ityavidiyate. Then only he is called as a swastha or the healthy individual. So Ayurveda is a very, very basic concept of a human. He is considered to be a Panchavimshati Purusha. There are the 25 factors, the combination of which is called to be a human. Says Prakriti, it's very, very basic. Prakriti, Purusha, Mahat and Ahankara, the 4 factors. Jnanendriya, the 5 sense organs. Karmendriya, the 5 functional organs. The Manas is a mind, the again 11 factors. And Panchamahabhuta, you may be knowing, Prithvi, Up, Teja, Vayu, Akasha, the 5 basic elements of the whole universe, that is Panchamahabhuta, and Panchatanmatra, that is the perception with these Panchamahabhutas, like Shabda, Sparsha, Rupa, Rasa, Gandha. So these are the 5. So that makes 10. Totally, a man is considered to be a Panchavimshati Purusha. So we have a similarities with the body and the whole universe. What you call it as Loka Purusha Samyata. What is there in the body, that is there in the universe. That is Brahmanda and Pindanda. What is there in the Brahmanda, the whole universe, that is there in the Pindanda or the human body. That is, once a person dies, when the Atma moves out of the body, then what is left behind is the Sharira. So that is will merge with the universe. Merge with the universe means what you call it as Panchatvagatam. It becomes a Prithvi, Up, Teja, Vayu, Akasha. So all these merges together and the body is lost. So once the Atma moves from the body, that is why what is there in the universe is there in the body, and what is there in the body is nothing but what is there in the universe. That is what the Ayurveda says, Loka Purusha Samyata or Brahmanda and Pindanda concept. Then I have told there are 3 doshas. One is Vata, Pitta and Kapha. That is a one. The equilibrium of 3 doshas is essential for the complete health of an individual. So it will work like the Visarga Adhana Vikshepaihi, Soma Surya Anilaryatha, Dharayanti Jagaddeham, Kapha Pitta Anilastatha. That is Visarga, Adhana and Vikshepa. Like that of Soma, Surya and Anila. The air, the water and earth. Soma, Surya, Anilaryatha. So like that, the Vata, Pitta and Kapha works in the body, that makes the Samyata or the equilibrium between 3 doshas and the combination of Loka and Purusha Samyata. So next coming about the Prakriti. So what is a Prakriti? So you may be knowing, if a person comes into the OPD, then we assess the person whether he is Vataja Prakriti, Pittaja Prakriti. Prakriti is what he is born with the qualities of Vata, Pitta and Kapha. So Vataja Prakriti patient, they are prone to develop the neurological disorders or ortho neuro diseases. Pitta Prakriti patients like gastritis, Pittaja skin diseases. Kapha Prakriti patient, like they may be suffer from the respiratory illness or some other Kapha disorders, the obesity, etc. So likewise, we assess the person whether he is a combination of Vata Pitta, Vata Kapha, Pitta Kapha, or a equilibrium of Vata Pitta Kapha. So with this we have 7 bodily structures with the mind, whether it is called as Sharirika. And then comes into the Manasika Prakriti. That is Sattvika, Rajasika and Tamasika. There are 3 mental Prakritis in the person. Sattvika means he is a very good person. He never gets anger, highly polite, and he never develops jealous. He wants to share the things and treat the all other persons poor, and they help the poor. Like all good qualities are there in such individual. You call it as Sattvika. He never gets irritated. These are all the Sattvika mind qualities. Then a Rajasika person. Rajasika means for small things he gets outburst of anger. So he gets irritated, anxiety, all those things will be more. Then Tamasika person, So he'll be sitting and sitting, not working, no desire for work, very low energy level. So such the qualities of the mind we make classify the individuals having sattvika, rajasika and tamasika persons, depending upon the manas and depending upon the constitution of the body. So next coming into Tristambha of Sharira. Tristambha, they are the three pillars on which the health is standing. That is Ahara, Nidra, Brahmacharya. Ahara, the diet, Nidra, the sleep, and Brahmacharya, or the celibacy. So with these three factors, our whole body health stands. So there are some clues. So there are hundreds of the vicharas or the matters in the Ahara concept, but I give one or two examples like to understand what is said in Ayurveda, like Hitashi syat, mitashi syat, kalabhoji jitendriyaha, pashyan rogan bahun kashtan, buddhiman vishamashanat. That is, a person should take hita ahara. Hita is not sukha. Hita, what is good for the body. Say, the milk is good. Say, the grita or the ghee is good. Hita, hitashi syat, mitashi syat, even if it is good, should be taken in a limited quantity, not in excess. Kalabhoji, that is timely food. If your scheduled time is morning, afternoon and evening, but Ayurveda says have only two food time. One is morning between 10:30 to 11 and another time is between 5:30 to 6 in the evening. But if you are scheduled to have 3 times food, then the time variation should not be done to be a healthy person. So Kalabhoji jitendriyaha. Why hitashi, mitashi, kalabhoji, pashyan rogan bahun kashtan, buddhiman vishamashanat. Vishamashana means if the food, your intake of food, the quality, quantity, the time, all they are deranged, then definitely person will going to suffer from n number of diseases. So a buddhiman, the person who is intelligent, should follow this ahara, the regimes. Then one more, I am just giving two examples. The one more is Bhojanante pibhet takram, Vasarante pibhet payaha, Nishante cha pibhet varihi, Tribihi rogana jayate. That is Bhojanante pibhet takram. So after having a meal, person should take buttermilk. Takra. Takra is the buttermilk, not the curds. Vasarante pibhet payaha. By the end of the day, that is night. So before going to sleep, the person should take milk. Nishante cha pibhet varihi. By the end of the night, that is morning, the person should drink water. So water in the early morning after getting up from the bed, after having food, buttermilk, and while going to sleep, paya or the milk. So these are the best, the regimes of having the liquids in your diet. So these are two examples because ahara or the food makes a one pillar of health. The second pillar of health is the nidra or the sleep. So one or two examples I give. One is Brahmi muhurte uttishtet swasto rakshartham ayushaha. Rakshartham ayushaha. If you want to be healthy, to keep your body healthy, to have a healthy long life, the person should wake up at Brahmi muhurta. Brahmi muhurta means almost between 4:30 to 5:30. So if you sleep and get up at 7, 8, then definitely it will going to cause the diseases. That is why Acharya says, Nidrayattam sukam dukkam pushtihi karshyam balabalam. Nidrayattam, everything depends. Sukha depends on sleep. The dukkha of the body depends on sleep. Pushtihi, the development of the body. The small children, they sleep for 16 hours, 18 hours for the development of the body. Pushtihi, karshyam. If the person doesn't sleep properly in a proper time, then he will become weak and lose weight also. Balabalam, the strength of the body also depends upon the sleep. Vrishata, klibata, jnanam, ajnanam, the ability to have concentration, ability to retain the things, ability to memorize the things, jnana, ajnana, so everything, jivitam, the whole life depends upon nidra or the sleep. This is the second pillar of health. He says, what are the varieties of the sleep and all? Tamo bhava, sleshma samudbha, something like. So I have given 2 examples, and brahmacharya, that is a celibacy. So this is about the sexual life of an individual. So these are the three stambha of the health. Now coming into the one more important factor, what the Ayurveda says is dharaniya and adharaniya vegas. So one has to understand what urge should not be suppressed. One should not suppress the urge of the flatus. So if there is a abdominal flatulence with a gas, if the person who wants to pass out the gas should not suppress, otherwise it move upwards in the body to produce the disease like gastritis, etc. With the bowels, the motion, the person should not suppress the motion. If a person suppresses the motion and becomes constipated, that is a root cause of all illness in the body. The mutra, that is, the person should pass the urine, so should not suppress for hours together in the working place or something like. If a person retains the urine for some 8 hours, 9 hours without passing, there is a possibility of getting the BPH or prostatic enlargement in males, or the stones, urinary stones. So it may lead to some more infections, etc. Kshavatrit, that is hunger and thirst, should not be suppressed. Then the nidra kasa shramashvasa, the bout of cough should not be suppressed. The bout of respiration should not be suppressed. Like that, he says one should not suppress these urges. And what should be suppressed? You should not express what? That is also said in our science. That is, lobha shoka bhaya krodha manaveghan vidharayet. Lobha, shoka. If you are too much depressed, shoka, so don't get so much depressed. You suppress that urge so that you should not become depressed. Bhaya, or the fear. So you should not get excessively fear about the things. You suppress the urge of fear, the Acharya says. And if you have lajja, irshya, jealous, if you express the jealous excessively, then it will convert into diseases. So suppress the jealous, suppress the the manasika vegas. So by looking into others' development, sometimes some persons never accepts the others' development or others the good things. So all these things gets converted into diseases in the person. Then that is why it is said in Ayurveda that anuyayat pratidinam sarvadharmeshu madhyamam na ati sarvatra varjayes. Excess should always be deleted. We should not indulge in excess in anything, even if it is good. If you say the milk is good, one cannot have 3 liters of milk, 4 liters of milk per day. It is good. If a person, if it is said that Vyayama is good, so it should be like Vyayama only. If it is excessively done in the gym, so it becomes a Sahasa. It is not Vyayama. It can suddenly cause some abnormalities in the individual. Whatever is good should always be not in excess. So, Anuyayat Sarvadharmeshu Madhyamam. You should be always moderate in the ahara, nidra. If nidra is good, one cannot sleep for 10 hours, 12 hours per day. Nidra should be done at stipulated 7 hours, 8 hours. So, considering it as good, one cannot sleep 10 hours, 12 hours. That may also induce diseases. Okay. So, Sarvadharmeshu Madhyamam. Always it should be in moderate, whether it is good or bad, should be in moderate. So, next comes the dinacharya. There are some more aspects said. Abhyangam acharya nityam jarashrama mataha drishti prasada pushtyayuhu swapna sutakta dadyakrit shirahashravana padeshutam visheshana shilayet. Our science, Ayurveda, says one has to go for oil massage every day. Every day. Abhyangam acharya nityam. Nitya is every day. One should go for massage, oil massage every day. That is what the Ayurveda says. But what the people do, they go for Abhyanga once in a year on Deepavali. See, this is not, you see, you have to go for the Abhyanga. What is the benefits? So the drishti, the eyes, the eye disorders doesn't happen, and you'll have a good sleep, and the skin, muscles, bones, nerves, everything gets nourished by the massage. So Shirahastravana Padesh. See, these are all the benefits of the Abhyanga. Then about Vyayama or the exercise, he says, Karma Samartyam Deepognir Medasakshayaha, to reduce the weight of an individual. Karma Samartya, the ability of the individual for the tolerance, the Vyayama should be done. Then how much Vyayama? Ardha Shaktya So half of strength is utilized, the whole strength. If whole strength is in Vyayama, suddenly it may this lead to gym has collapsed. So collapse. Why the person collapsed? Because he puts the whole strength in the activities of the gym. Only Acharya says, Ayurveda says, Ardha Shaktya Nishevyastu. Only half energy should be utilized in the Vyayam. So now coming into one interesting aspect, what is said in the Ayurveda is about Rutucharya. Rutucharya is detoxification. See, he says Vasanta Rutu. Vasanta Rutu, one should, Vasanta Rutu, it will be like in the month of March or April. Like if a person suffers from Kapha diseases, can go for Vamana as detoxification. Varsha Rutu, Vata as Basti as detoxification. And Sharad Rutu, where the Pitta diseases are seen, one should go for Virechana as detoxification. I tell you what is detoxification. Detox is you are cleansing the body. That is to promote the health. That is to prevent the diseases. You say so many after 30, 40 develops diabetes, hypertension, heart blocks, kidney diseases, some cancers, even in children also it is seen nowadays. So cancer, all these develops because of the not undergoing detoxification, because whatever we take either in the form of food or whatever we listen, so whatever we inhale, whatever we see, everything is toxic in this universe. I tell you why. Because the food, whatever you purchase, so it is adulterated. The oil, it is adulterated. Vyaparam droha chintanam. The business is to make others see, so that you can earn money. Droha chintana. So you have to, if you, ghee is good, ghee is adulterated with some fat and it is given a fragrance. And rice and whatever you procure, so everything is adulterated. And the fast foods, they are all mixed with the MSG or the chemicals. Fruits, so they are, they are ripened by adding some chemicals over it. The apples, they are coated with the wax. Whatever the milk, the cows are given injections. So what food you may have crores and crores of money, but the thing is that everything is toxic here. So then what best we can do? So you cannot change the whole society as one. So what best you can do is you can make your body detoxed. So whatever toxicity, what you call it as cumulative toxicity, this accumulated toxicity can be removed from the body through detoxification or cleansing. See, we purchase the scooters, we purchase the car, etc. Though it is under good condition, we give it for service. So in the same way, body should be given service. Though it is in good condition, so we have to give service to the body, detox to the body, so that the person should not suffer from threatening diseases in the days to come. So the best way is detoxification. We call it as Shodhana in the form of either Vamana or in the form of Virechana. So as a time doesn't permit, I don't tell what is the Vamana, Virechana procedures and all. So here Acharya says, Jaram Kritrena Labate, Chiram Jivati Anamayaha. What is the benefit of getting detoxification? Chiram Jivati Anamayaha. Anamaya andre no disease. Chiram Jivati, person will live long without diseases. This is a Palashruti, the benefit of having detoxification. We conduct in our hospital, we conduct regular camps of detoxification. So many hundreds persons, healthy individuals, the deceased person participate in this for the detoxification procedures. So now coming into what is disease as said in Ayurveda. The causative factors, dis is the Ease is comfort. Comfort is deranged, is disease or roga. So the causative factors are mainly three. Kalartha karmanam yogo, hina mityati matrakaha, samyak yogascha vijneyo, roga rogaika karanam. So misuse of senses. The first reason what Ayurveda says is misuse of senses. Senses, you listen. The ear is a sense organ. So you listen. So good things to be listened. Abnormal things, the high volume pitch sounds and a worst possible, the mobile, using every day, listening hours together. Or you see vision is another sense organ. So you see laptops hours together working in it, small microphones, etc. So listen and looking into it, like all sense organs, if it is misused, the tongue is also a sense organ. So because for the happiness, the all other rubbish food if a person takes, then it can lead to the diseases. Doing mistakes knowingly is another cause. This is not said by me, it is by Ayurveda only says. That is prajnaparada. Knowingly doing mistake. Say there are person who comes for de-addiction. They take alcohol, they smoke, and any other abnormal addictions are there. They know that this is bad, still they are doing it. Doing mistakes knowingly is one more cause of diseases. And the third one is the effect of seasons. As you see, the effect as a season like the COVID. So it is a pandemic, or because of the floods, or because of the earthquakes, or abnormal time raining. So seasonal problems, there can be diseases. So these are the three causes: misuse of senses, doing mistakes knowingly, and effects of seasons. And apart from that, the Ayurveda says Adhyatmika, Adibhautika, and Adhidaivika is a cause of diseases. That is the hereditary, the genetic, the external injuries. So all they fall under these groups of causative factors. So next comes the treatment and diseases. Ayurveda classifies the diseases as two. One is Sharirika and Manasika. Sharirika means physical. Any disease, say for example, asthma, in the skin, the psoriasis, or you say arthritis, they are all physical. And the second one is mental. Mental or the psychological diseases like the anxiety or the depression, schizophrenia, etc. The psychological disorders, these are the two groups of diseases. And one more, the classification of diseases is Nija and Agantuja. Nija means internal. Internal means somatic. Inside the body, the things are happening abnormal and it is presented as a disease. The second one is the external or the injury. Say, for example, a road accident or any accidents. Externally, injury, a person falls, something becomes sick, then you call it as external injury causing Agantuja Vyadhi. So, there are two classifications. One is somatic and psychological, internal and external causing diseases. So then how come it becomes a disease with these causative factors? The first is there will be disequilibrium of what I already said is dosha, dhatu and mala, and impairment of the agri. See, agri is considered to be the major factor. Whatever you eat first undergoes digestion. Undergoes digestion by the digestive fire. You call it as digestive fire. So abnormal fire is a root cause for all the diseases. Sarve rogaha mande agnau sutaram udar. Sarve rogaha, all diseases, mande agnau. Abnormality of the agri or the digestive fire is a cause for all the diseases. What the Acharya says, if agni is good, no disease. If agni is bad, every disease. So agni is given a major importance, digestion and metabolism. Agni at digestive level, agni at the tissue level. So a displeased or unhappiness of the Atma, Indriya and Manas, all these three factors makes a pathological process in the development of the diseases. Ayurveda says, Hetu, Linga and Aushadajnanam Swasthatura Parayanam. The causative factors, the diseases presentation, clinical features and its treatment, all is said in the Shashwata, that is the Ayurveda science. It is considered to be three sutra. One is cause of the disease. The Linga means the clinical features of the disease. Aushadha means treatment. All these three are explained in Ayurveda. Now coming into the treatment aspects, what is said in Ayurveda as a basic, we have 8 branches. You know, in modern science, there are varieties and varieties of specialities. You say ENT specialist, one is ortho, another one is neurologist, another one is surgeon, okay, or pediatrician or physician, you call. So in our Ashtanga Hridaya, that is written by the Vagbhata, he said there are 8 branches of Ayurveda: Kaya Bala Grahordvanga, Shalyadamshtra Jaravrisha, Ashtavangani Tasyahushtikitsa, Yeshu Samshita. These are the 8 branches of treatment of Ayurveda. So it is not that it is a modern concept of pediatric, that and this. It is set 5,000 years back. There are 8 branches, specialities in the treatment of the diseases. We'll go into 8 branches with a small glimpse. The first one is the Kaya Chikitsa, that is a general medicine. What you see, the general physician, he looks into the diseases, examines and treats. It's a general medicine. And second one is Balaroga. It is pediatrics, the treatment the diseases of the children. And Graha Chikitsa, that is psychiatry, is explained as Graha Chikitsa in Ayurveda. And the Urdhva, it is Shalakya Tantra, we call, is a ENT and ophthalmology, falls under Urdhvanga Chikitsa or Shalakya Tantra. And Shalya Tantra is general surgery. The Sushruta is considered to be the father of surgery. Even modern textbooks, in the first page, they say father of surgery is Sushruta. He is from sages, from age back, we call it as the father of surgery. So he has mentioned so many surgeries in our Ayurveda, that is Sushruta Samhita. His treatise he has written what are all the surgery he used to do in those days. Then comes Damshtra, or what you call it as Agada Tantra, toxicology and forensic medicine, the snake bite, food poisoning, the bite by the insects, all toxic material, the forensic system of medicine, that is Agata Tantra, is said in Ayurveda. Next comes Jara Chikitsa, that is the geriatrics. The Jara is considered to be a Swabhavika Vyadhi. If the person goes on with increased age, because of the aging process only, the person suffers from some diseases, degenerative diseases of the bone becomes weak, nerve becomes weak, the brain shrinks, the liver, and every individual organs, they deteriorate in their function. So the person, though healthy, will suffer from a Swabhavika Vyadhi like the Jara. So that is what called as geriatrics. Then comes Vrisha Chikitsa, or the sexual dysfunctions are also treated like in the form of Vajikarana. Vajikarana is another branch wherein the sexual function, infertility and other treatments, other diseases are treated. So that makes 8 branches of Ayurveda. So here these are the branches, and we have the factors for treatment. Factors of treatment. The Charaka, he says, these are the 4 factors very, very important for treatment of a person or taking care of a person. That is, we call it as Chikitsa Chatushpada. That is Bishak, doctor; Dravya, that is medicine; Upasthatha, that is a nurse, the one who takes care; and the Rogi, that is a patient. He gives four qualities to the each factor. Say who is the best doctor, which is the best medicine, who is the best nurse, and who is the best patient. Again, 4 qualities are given in our science. The qualities of a patient should be affordable. If the patient is very poor, then whatever the medicine we give, he cannot afford. Then that makes the person very incapable of receiving the treatment. Then Bishagvasya, he should be obedient towards the doctor. Whatever doctor prescribes, whatever suggests, should be able to do it, and should have good memory and having good sattva or the strength. So even if we console that you will become all right, to go on calling all the patient parties and make them draw the attention of the patient parties and all, having less sattva, he doesn't become all right. So these are the good qualities of a patient. Then good qualities of the doctor is should be alert and disciplined, having detailed knowledge regarding disease and treatment, having practical experience, and the cleanliness. Then which is the best medicine? So should able to have a Bahukalpa, varieties, and Bahuguna have enormous qualities endowed with virtues and appropriate for specific diseases. And qualities of a nurse: compassion towards patients, should be clean, alert, active, and should be intelligent. So these are the 4 factors given with four qualities to the each factor is very, very important for treatment of the diseases. Then we have modalities of treatment. We have 2 modalities. Basic modalities is Shodhana and Shamana. Shodhanam Shamanam Cheti Samasat Aushadam Dvidha. Shodhana is elimination of toxins, what I was describing like detoxification, and Shamana is the disease subsiding medicaments, the medicines, herbal medicines, and cleansing the body. So that makes the major pillar of treatment of the diseases. And Acharyas in Ayurveda, they say Daiva Vyapashraya, Yukti Vyapashraya, and Sattvavajaya line of treatment. Daiva Vyapashraya means spiritual healing. So we should endow. So we should say that everything is due to God. Then if you give responsibility of my health to the God, then you will be devoid of all anxiety, depression, etc. A spiritual healing has been explained. Then Yukti Vyapashraya, again 3 modalities. We have plenty of references, plenty of modalities under each sector in the treatment. So a brief regarding the Shodhana or detoxification. What is globally, it is now getting popularized as Panchakarma. So we have Vamana or emesis as treatment, Virechana or purgation as treatment for detoxification. The Basti or the Enema is considered to be the first line of treatment for neurological disorders. What our intestine says, the brain should listen. What you call it as gut-brain axis. So now all the modern people are also coming into the concept of enema or the gut-brain axis in the treatment. Next comes Nasya or the nasal drops, which is highly beneficial in disorders above the neck, and Raktamokshana or bloodletting, so which draws out the toxic blood so that the skin or the pain, so all these things can be corrected. So these are the 5 basic modalities of Panchakarma. Apart from these, we have some 70-80 varieties of Upakarmas like Panchakarma. We have the Udvartana or the powder massages for as a treatment for the obesity or some neuropathy, etc. condition. We have Potali Swedas where the medicaments are tied in a potli or you say pack, and it is applied over the patient's body with oil, without oil, some powders, the herbs, they are fried and make a potli. Or we have rice, cooked rice with the milk and made potli in, we call it as Shastikashali to strengthen the nerves and all. We have varieties and varieties of treatment, Upakarma in the Panchakarma procedure. You can see the photos of Bashpasveda. After the oil massage, we make the patient to sit or sleep in a steam chamber to have a sudation therapy, to sweat, so that cleanses the body and gives a very good remedy for the muscles, bones, nerves, etc. So I have not put into many of the therapies. So these are just glance, or you can have a bird's eye view on some of the therapies. And these are about the therapies. And now comes the medicinal herbs. There are some 300, 400 detailed drugs with what is used for what, which disease, and how it promotes the health, and how it cures the diseases. What are the combinations of the oil, the ghee preparation, the tablets, the powders, you call it as a churna, kashayam tablet. So many, there are so many pharmacies, renowned pharmacies in Karnataka, Kerala, like preparing so many medicaments which are good for the treatment of the diseases. Some glands, like you have Eranda, you might have seen what you call it as Eranda or Haralenne, the castor. Then Amalaki. Amalaki is a gooseberry, Indian gooseberry, what you call. We used to say that an apple a day keeps the doctor away earlier. Now we can change it as an amalaki a day keeps the doctor away. It is considered to be the best immune booster. Acharya says you give amalaki or this and you health can be promoted. Then you might have heard of Chavanprash, a Chavan Maharshi who has taken this Chavanprash made out of amalaki and he's reversed his aging process. So we have some rasayana, Kutipraveshika rasayana also there. So wherein patient is only fed with Chavanprash and you can reverse the features of a aging. We have 3 centers in India, like who are given Kutipraveshika rasayana only with amalaki. So you have seen this Kumari or aloe vera and the Shunti or the Gingibar officinale, the Brahmi, the Karela, the Jamun, the Gokshura. So likewise we have 300, 400 drugs. So in a different combination, which will promote the health and cure the diseases. And this is a wonderful concept of Ayurveda. You call it as a blessing from our sages to the humanity. That is a rasayana or immune booster therapy. So if you go into modern science, they give steroids and suppress the immunity. Whereas we never use immune suppressants in the treatment of diseases. Here we make immune boosters. We make the immune to be increased so that he can fight with the disease. So there are varieties of immune boosters therapy. That immune booster therapy is called as the rasayana. By the method adopted, there are 2 types, Kutipraveshika rasayana and Vatatapika rasayana. Kutipraveshika means a person is made to enter into a room, so which is constructed one inside the other. Like you have seen some olden temples wherein one inside the other there is a kutis, so inside which there is God, the idol of God is kept. Like that, the person is made to enter after detoxification. He is made to enter into the 3rd kuti and he is fed with only Chavanprash. The Chavanprash is prepared with the forest grown, the amalaki or the Indian gooseberry, and for which the gritha is used, that is ghee is used for in its preparation, for which the cows are fed and they are taken care. And even if a person develops hungry, then only Shashtikashali rice, a variety of rice boiled with the milk is given to the person inside. But to have the purest milk, the cow is also fed with 1 to 2 kg Chavanprash, and a purest the milk is taken and a person is fed who is inside the kuti. And you can witness in one Kerala, in Gujarat, one Kutipraveshika rasayanas are there. So totally he becomes totally healthy. Even the white hairs, they become reversed, like it becomes the mustache, beard, everything becomes black. Then Vatatapika rasayana means the person who can take the rejuvenation therapy when he is under work only. So there are some medicaments which are used as Vatatapika rasayana. And by utility, the rasayana therapy is classified as Kamya rasayana. Kamya means if a person is a singer, wants to improve the voice, then we have the immune booster therapy for the voice. So if a person wants to have a very good hair, then the Keshya rasayanas are there. So want to improve the longevity of life, Ayush Kamya rasayanas are there. Likewise, they are called as Kamya rasayana. Naimittika means nimitta. If a person is suffering from diabetes mellitus, to prevent complications like retinopathy, the kidney damage, vascular blocks, we have rasayana or the medicaments which prevents those complications. If a person is suffering from years together asthma, to improve the quality of the lungs, we have the naimittika rasayanas. Like depending upon the disease, we can have the rejuvenators. The Najastrika rasayana is considered to be the nitya rasayana. What is best to take every day as an immune booster is a nitya kshira grita abhyasa. The milk and ghee is considered to be the nitya kshira grita abhyasa, is considered to be the immune booster. You might be knowing that the Indians mother always feed the child with the ghee and milk every day. That is why all over the world the Indians are the personal assistants to the some the major in major other countries, they become personal assistant in the some offices. Like they, because of their brilliancy, they make anything and every wonder things happen. Why? Because our brain is considered to be the, it is a lipid. It is considered to be the lipid. Ardha vilina grithakaro mastaka majja. If you want to improve the brain and mind, the best thing is ghee. If you want to improve the nerves, the best is ghee. So, but nowadays, the Western medicine, they have changed the concept to a fat-free diet. Absolutely wrong concept. So we have to have ghee every day. We have to have milk and make sure that whatever the milk and ghee you use should be the purest. It should not be an adulterated one. So these are about the immune boosters, a blessing and a booster for the humanity, which is given by our sages through Ayurveda. So now coming into the yoga, dhyana. Yoga and dhyana are again important factors which are coming under sadvrita. How a person should live, what is its behavior, how he should, how and what conduct he should have, how he should behave with the society, how he should behave with himself and the family members, sadvrita. And yoga, dhyana, the meditation, yoga, so this tattva jnana, they all takes the person to his salvation, that is dharma, artha, kama, moksha. So that can be achieved through these things. It was detailed in Ayurveda. Just I have put one slide because of the time constraint. So now at the last, see, before last, I would like to say Ayurvedo Amritanam. If anything is Amrita in this universe, that is Ayurveda. Ayurvedo Amritanam. So this is said in Ayurveda only. Ayurvedo Amritanam. So now a take home message I want to give, that is Sarvamanyam Parityajya Shariram Anupalaye Tat Abhavo Hi Bhavanam Sarvabhavaha Sharirinam. That is Sarvamanyam Parityajya. You need not worry about anything. Only you worry about the health. So you should keep your health properly. You should have arogya. Shariram Anupalaye. You should care your body and mind. Why? Tat abhavo hi bhavanam. If there is no health, no arogya, then everything is a waste. Sarva bhavaha sharirina. Everything is a waste. So keep your health proper, then only you can achieve dharma, artha, kama, moksha, which is the ultimate goal of a human being. So this is just a bird's eye view on the basic fundamental concepts of Ayurveda. So now if you have any doubts, like it's okay that you can ask. So with this, I thank the organizers for giving me this opportunity to share just the fundamentals of Ayurveda to this delegates. Thank you.
Madam, namaskar. Very good presentation. Very good information. Very nice presentation. Thank you very much.
ಮೇಡಮ್ ಹಿತ ಅಂತ ಹೇಳಿದ್ದು ಬಹಳ ಖುಷಿ ಆಯ್ತು ಮೇಡಮ್. ಹಿತ ಅನ್ನೋದನ್ನ ಬಹಳ ಚೆನ್ನಾಗಿ ವರ್ಣನೆ ಮಾಡಿದ್ರಿ. ಆಮೇಲೆ ಸೇಬು ನೆಲ್ಲಿಕಾಯಿ ಈಕ್ವಲ್ ಅಂತ ಹೇಳಿದ್ದು ಬಹಳ ಖುಷಿ ಆಯ್ತು ಮೇಡಮ್. ಆಮೇಲೆ ವಾತ ಪಿತ್ತ ಕಫ ಅನ್ನೋದನ್ನ ತುಂಬಾ ಚೆನ್ನಾಗಿ ಹೇಳ್ಕೊಟ್ರಿ. ಹಾಗಾಗಿ ತುಂಬಾ ಅದ್ಭುತವಾಗಿತ್ತು ಮತ್ತೆ ಸರಳವಾಗಿ ಮನಮುಟ್ಟುವಂತೆ ತಿಳಿಸಿದ್ರಿ ಮೇಡಮ್. ಅದಕ್ಕೆ ವೀಣಾಜಿ ಎಲ್ಲಾ ಸಹಪಾಠಿ ಸಹೋದ್ಯೋಗಿಗಳ ಪರವಾಗಿ
Thank you, sir.
ಮೇಡಮ್ ನಮಸ್ತೆ.
ನಮಸ್ತೆ.
ಈಗ ಇದುವರೆಗೂ ಆಯುರ್ವೇದದ ಬಗ್ಗೆ ತಿಳಿಸ್ಕೊಟ್ರಿ ತಾವು. ಈಗ ಯಾವುದೇ ಒಂದು ಸಮಸ್ಯೆ ಬಂದ್ರೆ ಅದಕ್ಕೆ ಆಯುರ್ವೇದದ ಮೂಲಕನೇ ನಾವು ಪರಿಹಾರನ ಕಂಡ್ಕೊಳ್ಬಹುದು ಅಂತ ಅನ್ನೋದನ್ನ ನಾವು ಕೋವಿಡ್-19 ಸಮಯದಲ್ಲೂ ಕೂಡ ಅರ್ಥಕೊಂಡಿದೀವಿ. ಬಟ್ ಈಗ ವಿಜ್ಞಾನ ತಂತ್ರಜ್ಞಾನ ತುಂಬಾನೇ ಮುಂದುವರಿತಾ ಇದೆ. ಈಗ ಕೆಲವು ಮಾರಕ ರೋಗಗಳಿದೆ ಇವತ್ತಿಗೂ ಕೂಡ ಜಗತ್ತಿನಲ್ಲಿ, ಅದನ್ನ ಪರಿಹಾರ ಮಾಡ್ಕೊಳ್ಳೋದಕ್ಕೆ ಆಗದಲ್ಲೇ ಇರುವಂತದ್ದು. ಈಗ ಲೈಕ್ HIV ಆಗಿರ್ಬೋದು, ಮತ್ತೆ ಬೇರೆ ಬೇರೆ ಡಿಸೀಸ್ ಆಗಿರ್ಬೋದು. ಇದಕ್ಕೆ ಆಯುರ್ವೇದದ ಮೂಲಕ ಯಾವ್ದಾದ್ರು ಪರಿಹಾರಗಳನ್ನ ಸೂಚಿಸಬಹುದಾ ಅಂತ. ಈಗ ಇದುವರೆಗೂ ಕಂಡು ಇದಕ್ಕೆ ಸಾಧ್ಯ ಆಗದಲೇ ಇರುವಂತಹ ಮೆಡಿಸಿನ್ ಅಂತಂದ್ರೆ ಅದು HIV ಕಾರಣಕ್ಕಾಗಿ. ಇದ್ರ ಮೂಲಕ ಏನಾದ್ರೂ
ಈಗ ಇದು ಏನಂತ ಹೇಳಿದ್ರೆ ಇದಕ್ಕೆ ಜನಪದೋದ್ವಂಸ ಅಂತ ಹೇಳ್ತೀವಿ ನಾವು. ಅಂದ್ರೆ ಒಬ್ಬರಿಂದ ಒಬ್ರು ಹರಡುವಂತ ರೋಗ HIV. ಸೊ ಇಲ್ಲಿ ಏನಾಗುತ್ತೆ ಅಂತ ಹೇಳಿದ್ರೆ ಅದನ್ನು ಇಮ್ಯುನಿಟಿ ಲೋ ಆದ್ರೆ, ಇನ್ಫೆಕ್ಷನ್ ಆದ್ರೆ ಇಮ್ಯುನಿಟಿ ಲೋ ಆಗಿರುವಾಗ ಪರ್ಸನ್ ಸಫರ್ಸ್ ಫ್ರಮ್ ಕ್ಲಿನಿಕಲ್ ಫೀಚರ್ಸ್. ಇಲ್ಲ ಅಂದ್ರೆ ನೀವು HIV ಪಾಸಿಟಿವ್ ಇದ್ರೂ ಕೂಡ ಗೊತ್ತೇ ಆಗಲ್ಲ. ಯಾವಾಗ ಗೊತ್ತಾಗುತ್ತೆ ಅಂದ್ರೆ ಇಮ್ಯುನಿಟಿ ಫುಲ್ ಲೋ ಆದಾಗ, CD ಕೌಂಟ್ ರೆಡ್ಯೂಸ್ ಆದಾಗ ಅಲ್ಲಿ ಕ್ಲಿನಿಕಲ್ ಫೀಚರ್ಸ್ ಬರುತ್ತೆ. ಸೊ ಇನ್ಫೆಕ್ಷನ್ಗೆ ಇಮ್ಯೂನ್ ಬೂಸ್ಟರ್ಸ್ ತರ ನಾವು ಪರ್ಸನ್ ಈಸ್ ಸಫರಿಂಗ್. there are many diseases for which a absolute remedy has not found. ಬಟ್ ಏನಂದ್ರೆ ಅದನ್ನು ಮೇಂಟೈನ್ ಮಾಡುವ ತರ ನಾವು ಡೆಫಿನೆಟ್ ಮಾಡಬಹುದು. ಒಬ್ಬ ಪೇಷಂಟ್ ಡಯಾಬಿಟೀಸ್ ಇಂದ ಸಫರ್ ಮಾಡ್ತಾ ಇದ್ದಾನೆ, ಎ ಕಂಪ್ಲೀಟ್ ಕ್ಯೂರ್ ಹ್ಯಾಸ್ ನಾಟ್ ಯೆಟ್ ಡೆವಲಪ್ಡ್. ಆದ್ರೆ ಅವನ ಆಯುಷ್ಯ ಇರುವ ತನಕ ಆರೋಗ್ಯವಾಗಿ ಇರುವ ಹಾಗೆ ನಾವು ಮಾಡ್ಬೋದು. ಆಗ ಪ್ರಮೇಹ ಅಂತ ಹೇಳ್ತೇವೆ ನಾವು. ಅದಕ್ಕೆ ಪ್ರಮೇಹ ಈಸ್ ಕನ್ಸಿಡರ್ಡ್ ಟು ಬಿ ಯಾಪ್ಯ ಡಿಸೀಸ್. ಯು ಕೆನಾಟ್ ಬಿ ಕಂಪ್ಲೀಟ್ಲಿ ಕ್ಯೂರ್ಡ್ ಅಂತಾರೆ ಸೈನ್ಸ್ ನಮ್ದು ಆವಾಗದಿಂದ. ಅದೇ ತರ ಈ ಇನ್ಫೆಕ್ಷನ್ಸ್ ಗಳೇನಿದೆ, ಇನ್ಫೆಕ್ಷನ್ ಆಗೋಗಿದೆ, ಅಬ್ಸಲ್ಯೂಟ್ ರೆಮಿಡಿ ಇಲ್ಲ ಅಂತಂದ್ರೆ, ಬಟ್ ಟಿಲ್ ದ ಪೇಷಂಟ್ ಎಲ್ಲಿ ತನಕ ಅವರು ಇರ್ತಾರೆ ಆರೋಗ್ಯವಾಗಿರುವ ಹಾಗಂತೂ ಡೆಫಿನೆಟ್ ಮಾಡ್ಬೋದು. there are so many researchers have conducted to boost up the immunity of patients of HIV, tuberculosis. ಈ ತರ ಯಾವ್ಯಾವ್ದ್ರಲ್ಲಿ ಇಮ್ಯೂನ್ ಲೋ ಆಗುತ್ತೆ, ಪರ್ಸನ್ ಸಫರ್ಸ್ ಫ್ರಮ್ ಡಿಸೀಸಸ್. ಈಗ ಎಷ್ಟೊಂದು ಡಿಸೀಸ್ ಇರುತ್ತೆ, ಲಕ್ಷಣಗಳೇ ಇರಲ್ಲ. ಹಾಗೆ ಲಕ್ಷಣ ಫ್ರೀ ಆಗಿ ವಿತ್ ನೋ ಕ್ಲಿನಿಕಲ್ ಫೀಚರ್ಸ್ ಯು ಕ್ಯಾನ್ ಮೇಕ್ ದ ಪರ್ಸನ್ ಟು ಲೀವ್ ಹೆಲ್ದಿ ಟಿಲ್ ದ ಎಂಡ್. ಆ ತರ ಅಂತೂ ಡೆಫಿನೆಟ್ ಸೋ ಮೆನಿ ರಿಸರ್ಚಸ್ ಆನ್ HIV, tuberculosis, ಆ ತರ ಮೆನಿ ಡಿಸೀಸಸ್, ಇನ್ಫೆಕ್ಟಿವ್ ಡಿಸೀಸಸ್ ಐ ಆಮ್ ಟೆಲಿಂಗ್. ಸೊ ಇನ್ ದಿಸ್ ಕಂಡೀಷನ್ even to the cancer. See, cancer ಈಗ ಅಷ್ಟೊಂದು ನೀವು what do you call the mortality, the morbidity, incidences of cancer is such that every third person is a cancer ಅಂತ ಹೇಳ್ತಾರೆ. ಈಗ every third person, ಪ್ರತಿ ಮೂರನೇ ವ್ಯಕ್ತಿ ಕ್ಯಾನ್ಸರ್ ಆಗ್ತದೆ. ಯಾಕೆ ಬರುತ್ತೆ ಕ್ಯಾನ್ಸರ್? ಸೊ when we have conducted a cancer day, we have called one oncologist from one renowned hospital to our college, and she was telling like we are living in the ocean of chemicals. ನೀವು ಏನಾದ್ರೂ ತಗೊಳ್ಳಿ, ಒಂದು ಹೇರ್ ಡೈ ಮಾಡಿದ್ಯಾ ಆ ಕೆಮಿಕಲ್, ನೀವು ಏನೇ ಒಂದು ತಗೊಳ್ಳಿ. she says that even if you want to die and ask for a poison, it is also adulterated. She was telling, say it is adulteration has gone to such an extent. ಸೊ ಇದಕ್ಕೇನ್ ಮಾಡ್ಬೋದು? ವಾಟ್ ಬೆಸ್ಟ್ ಕ್ಯಾನ್ ಬಿ ಡನ್? ಬಿಕಾಸ್ ಇವಾಗ ಏನು ಅಂತ ಹೇಳಿದ್ರೆ ಆರೋಗ್ಯಕ್ಕೋಸ್ಕರ ವಿ ಹ್ಯಾವ್ ಎ ಇಂಡಿಯನ್ ವೀಸಾ ಫಾರ್ ಹೆಲ್ತ್ ಸೀಕರ್ಸ್ ಫ್ರಮ್ ಈವನ್ ಫ್ರಮ್ ಅದರ್ ಕಂಟ್ರೀಸ್ ಫ್ರಮ್ ಆಫ್ ದ ವರ್ಲ್ಡ್. ಸೊ ನಮ್ಮಲ್ಲಿ ಈಗ ಡಿಟಾಕ್ಸ್ ಥೆರಪಿ ಇದೆ. ವಿ ಹ್ಯಾವ್ ಟು ಕ್ಲೆನ್ಸ್ ದ ಬಾಡಿ, ಟೇಕ್ ದ ರಸಾಯನ, ಸೊ ದಟ್ ವಿ ಕ್ಯಾನ್ ಕೀಪ್ ದ ಡಿಸೀಸಸ್ ಎಟ್ ಬೇ. ಸೊ ವಿ ಕ್ಯಾನ್ ಪ್ರಿವೆಂಟ್ ದ ಡಿಸೀಸ್. ಪ್ರಿವೆನ್ಷನ್ ಈಸ್ ಫಾರ್ ಬೆಟರ್ ದನ್ ಗೆಟ್ಟಿಂಗ್ ಕ್ಯೂರ್ಡ್ ಆಫ್ಟರ್ ಗೆಟ್ಟಿಂಗ್ ದ ಡಿಸೀಸಸ್. ಬಟ್ ಕ್ಯಾನ್ಸರ್ ಮೇಲೇನು ತುಂಬಾನೇ ರಿಸರ್ಚಸ್ ಆಗ್ತಾ ಇದೆ, ಒಂದೊಂದ್ರಲ್ಲೂ ಒಂದೊಂದು. ಸೊ ಗ್ರಾಜುವಲಿ ವಿ ಆರ್ ಕಮಿಂಗ್ ಅಪ್ ವಿತ್, ಬಿಕಾಸ್ there was a major gap between our sages and the modern people. There was a great gap in which there was the Western system of medicine has invaded the India, and they have taken a major share. So we don't say that every disease can be cured. So acute diseases, suddenly if something happens suddenly, then we have to go for a modern medicine which gives a absolute cure. But if it is a chronic for long standing, after ICU, after surgery, so definitely we can take care of the patient and give the absolute result to the patient.
ಮೇಡಮ್, ಇಂಥ ಅದ್ಭುತವಾದಂತ ಆಯುರ್ವೇದ ಜ್ಞಾನವನ್ನ ಈ ಬೆಳೆಯೋದಕ್ಕೆ ನಮ್ಮ ಇಂಗ್ಲಿಷ್ ಮೆಡಿಸಿನ್ ಡಾಕ್ಟರ್ಸ್ಗಳು ಬಿಡ್ತಾ ಇಲ್ಲ ಅಂತ ಅನ್ಸುತ್ತೆ, ಮಾಫಿಯಾ ಇದೆ ಅಂತ ಅನ್ಸುತ್ತೆ ಮೇಡಮ್.
Sir, I don't want to comment on that. Anyway, we have good support from the central government, even to conduct the research works. Even the research works are funded by the government for Ayurvedic research, even into the so many colleges, hospitals, the private sectors. So they are all conducting research to the minutest level for the upcoming, you should become a first care in the society, first health care in the society. So ಯಾಕೆಂದ್ರೆ ಈಗ ನೀವು ಏನೋ ಒಂದಾದ ಕೂಡಲೇ ಸಡನ್ ಆಗಿ ನೀವು ಮಾಡರ್ನ್ ಡಾಕ್ಟರ್ಸ್ ಹತ್ರ ಮೊದಲು ಹೋಗ್ತಾ ಇದ್ರು. ಆದ್ರೆ ಇವಾಗ ಏನಾಗಿದೆ ಅಂದ್ರೆ ಏನೋ ಆಯ್ತು ಅಂದ್ರೆ ಫಸ್ಟೇ ನಮ್ಮ ಹತ್ರ ಬರುವಂತದ್ದು ಬೇಕಾದಷ್ಟು ನಡೀತಾ ಇದೆ ಈಗ. ಫಸ್ಟಿಗೆನೆ ಇಂಗ್ಲಿಷ್ ಮೆಡಿಸಿನ್ಗೆ ಹೋಗದೇನೆ ನಮ್ಮ ಹತ್ರನೇ ಫಸ್ಟ್ ಬಂದು ಟ್ರೀಟ್ಮೆಂಟ್ ತಗೊಳ್ಳೋರು ಈಗ ತುಂಬಾ ಜನ ಇದ್ದಾರೆ. ಮೊದ್ಲು ಹಾಗಲ್ಲ. ಹೇಗೆ ಅಂದ್ರೆ ಮೊದ್ಲು ಇಂಗ್ಲಿಷ್ ಮೆಡಿಸಿನ್ಗೆ ಹೋಗುದು, ಅಲ್ಲಿ ಸರಿಯಾಗಿ ಆಗ್ಲಿಲ್ಲ ಅಂದ್ರೆ ನಮ್ ಕಡೆ ಬರ್ತಾ ಇದ್ರು. ನೌ ದ ಟ್ರೆಂಡ್ ಹ್ಯಾಸ್ ಚೇಂಜ್ಡ್ ಅಂಡ್ ಟ್ರೆಂಡ್ ವಿಲ್ ಚೇಂಜ್ ಎ ಲಾಟ್ ಇನ್ ದ ಕಮಿಂಗ್ ಇಯರ್ಸ್.
ಮೇಡಮ್ ನಮಸ್ಕಾರ.
ವೈಜ್ಞಾನಿಕ ಲೋಕಕ್ಕೆ ಒಂದು ಒಂದು ಮನೆಮದ್ದು ಅಂತಂದ್ರೆ ಈ ಆಯುರ್ವೇದ ಅಂತಾನೆ ಹೇಳ್ಬಹುದು. ಈ ಆಯುರ್ವೇದ ಎಲ್ಲಾ ಸಮಸ್ಯೆಗಳಿಗೂ ಒಂದ್ ರೀತಿಯ ಪರಿಹಾರನ ಕಲ್ಪಿಸ್ಕೊಡುತ್ತೆ ಅಂತ ಅನ್ನೋದಾದ್ರೂ ಕೂಡ ಇವತ್ತಿನ ಯುವ ಪೀಳಿಗೆ ಸಹಿತ ಇವತ್ತಿನ ಟ್ರೆಂಡ್ ಏನಿದೆ ಸಂಪೂರ್ಣವಾಗಿ ಆಯುರ್ವೇದನ ಮರ್ತಿದ್ದಾರೆ ಅಂತಾನೆ ಹೇಳ್ಬೋದು. ಯಾಕಂದ್ರೆ ಈಗ ಆಯುರ್ವೇದ ಆಸ್ಪತ್ರೆಗಳಿದೆ, ಸರ್ಕಾರದಿಂದನೇ ಸ್ಥಾಪಿತ ಆಗಿರುವಂತಹ ಅನೇಕ ಆಯುರ್ವೇದಿಕ ಸಂಸ್ಥೆಗಳು ಯಾವುದೇ ರೀತಿಯಾಗಿರ್ತಕ್ಕಂಥ ಪೇಷಂಟ್ಸ್ ಇಲ್ದೇನೆ ಖಾಲಿ ಹೊಡಿತಾ ಇರೋದು ಇವತ್ತು ಕಾಣ್ತಿದೀವಿ ಮೇಡಮ್. ಅಂದ್ರೆ ಜನರ ಬಗ್ಗೆ ಇದ್ರ ಬಗ್ಗೆ
ಆಕ್ಚುಲಿ ಸರ್ ಒಂದು ವಿಚಾರ ಒಂದು ವಿಚಾರ ಏನು ಅಂತಂದ್ರೆ, ಆತರ ಯಾವ ಪರಿಸ್ಥಿತಿ ಮೊದ್ಲೇನಿತ್ತು ಒಂದು 20 years ಬ್ಯಾಕ್ ಏನಿತ್ತು ಅದು ಕಂಪ್ಲೀಟ್ ಚೇಂಜ್ ಆಗಿದೆ ಇವಾಗ. ಸೊ ಯು ಕ್ಯಾನ್ ಸಿ ಎನ್ ನಂಬರ್ ಆಫ್ ಪೇಷಂಟ್ಸ್ ಕಮಿಂಗ್ ಇನ್ ಟು ದ ಆಯುರ್ವೇದ ಹಾಸ್ಪಿಟಲ್ ಗೆಟ್ಟಿಂಗ್ ಟ್ರೀಟ್ಮೆಂಟ್, ಎಜುಕೇಟೆಡ್ ಪೀಪಲ್. ಅದೇ ನೀವು ಹಳ್ಳಿಯಲ್ಲಿ ಹೋಗಿದ್ರೆ ಈಗಲೂ ಜನ ಒಂದು ಇಂಜೆಕ್ಷನ್ ಒಂದು ಮಾತ್ರೆ ಅಂತ ದೇ ಆರ್ ಇನ್ ಟು ಇಟ್. ಬಟ್ ವೆನ್ ಯು ಕಮ್ ಟು ಎ ಎಜುಕೇಟೆಡ್ ಕ್ಲಾಸ್ ಪೀಪಲ್, they are coming into Ayurveda and they are taking treatment, they are getting detox, they are taking preventive medicines ella. So this will become a mainstream of treatment in India in coming one in 20-25 years alli ide first line of treatment ಆಗ್ಬಿಡುತ್ತೆ.
ಮೇಡಮ್ ನಮಸ್ಕಾರ. ಮೇಡಮ್
1975ರಲ್ಲೇನೆ ಜಗದ್ದಳ ಸೋಮನಾಥ ಒಂದ್ ಕೃತಿನಲ್ಲಿ ಹೇಳ್ತಾನೆ, ಕರ್ನಾಟಕ ಕಲ್ಯಾಣಕಾರಕ ಅಂತ ಹೇಳಿ ಅವನ್ ಕೃತಿ ಜಗದ್ದಳ ಸೋಮನಾಥ ಬರ್ದಿರುವಂತದ್ದು. ಅಂದ್ರೆ ಪ್ರಾಚೀನ ಕಾಲದಲ್ಲಿ ಆಯುರ್ವೇದ ಎಷ್ಟು ಅವಶ್ಯಕ ಆಗಿತ್ತು ಜನತೆಗೆ ಅಂತ ಅನ್ನೋಂಥದ್ದನ್ನ ನೋಡಿ. ಒಂದ್ ಜ್ವರ ಬಂದ್ರೆ ಆತ ಹೇಳ್ತಾನೆ, ಜ್ವರದ ಆದಿಯೋಳು ಉಪವಾಸಂ, ಜ್ವರ ಮಧ್ಯದಲ್ಲಿ ಗಂಜಿ, ಪೇಳ್ವ ಕಷಾಯಂ, ಜ್ವರ ಪಾಕದೋಳ್, ಅಸ್ತಮಿತ ಜ್ವರದೋಳ್, ಮಲಹರಣಂ, ಏನಿತು ಇವು ಆರೋಗ್ಯಕಂ ಅಂತ ಹೇಳಿ. ಅಂದ್ರೆ
ಅದನ್ನೇ ಅದು ಕನ್ನಡದಲ್ಲಿ ಇದೆ ಅಲ್ವಾ ಸರ್? ಅದು ಕನ್ನಡದಲ್ಲಿ ಇದೆ ಅಲ್ವಾ? ನಮ್ ಸೈನ್ಸ್ ಅಲ್ಲಿ ಅದನ್ನು ಸಂಸ್ಕೃತದಲ್ಲಿ ಜ್ವರ ಆದವು ಲಂಘನಂ ಪ್ರೋಕ್ತಂ, ಜ್ವರ ಮಧ್ಯೇತು ಪಾಚನಂ, ಜ್ವರಾಂತೆ ಭೇಷಜಂ ತದ್ಯ, ಜ್ವರ ಮುಕ್ತೇತು ವಿರೇಚನಂ. ಇದನ್ನು ನಮ್ ಸೈನ್ಸ್ ಅಲ್ಲಿ ಆಲ್ರೆಡಿ ಇದೆ. ಅದನ್ನೇ ಅವರು ಕವಿತೆಯಲ್ಲಿ ಇದರಲ್ಲಿ ಬರೆದಿದ್ದಾರೆ. ಸೊ ಈ ನಮ್ಮ ಆಯುರ್ವೇದ ಪ್ರಾಚೀನ
ಸಮಸ್ಯೆಗಳಿಗೂ ಒಂದ್ ಮನೆ ಮದ್ದನ್ನ ಈ ಆಯುರ್ವೇದ ಅನ್ನೋದು ಕಲ್ಪಿಸ್ಕೊಡುತ್ತೆ. ನಮ್ ಜನರಿಗೆ ಒಂದ್ ರೀತಿಯಾಗಿರ್ತಕ್ಕಂಥ ತಿಳುವಳಿಕೆ ಪ್ರಜ್ಞೆ ಅನ್ನೋದು ಮೂಡ್ಬೇಕಷ್ಟೇ.
ಇದು ಡೆವಲಪ್ಮೆಂಟ್ ಆಗ್ತಾ ಇದೆ ಸರ್. ಇನ್ನು ಮುಂದಕ್ಕೆ ಇನ್ another 25-30 years definitely it will become a mainstream of treatment procedures in India.
ಮೇಡಮ್ ನೀವು ಮಾತಾಡ್ತಾ ಪಂಚಕರ್ಮ ಅಂತ ಒಂದ್ ಪದ ಬಳಸಿದ್ರಿ, ಅದನ್ನ ಒಂದ್ ಲೈನ್ ಅಲ್ಲಿ ಅರ್ಥೈಸಿ ಮೇಡಮ್, ಹೇಗೆ ಅಂತ.
ಸರ್ ಪಂಚ ಅಂದ್ರೆ 5, ಕರ್ಮ ಅಂದ್ರೆ ಟ್ರೀಟ್ಮೆಂಟ್ಸ್. ಇದು ಮೇನ್ 5 ಟ್ರೀಟ್ಮೆಂಟ್ ಇದೆ. ವಮನ ಅಂತ ಈ ಕಫ ಇರುವ ಡಿಸೀಸಸ್ ಗಳಿಗೆ ವೊಮಿಟ್ ಮಾಡಿಸ್ತೀವಿ ನಾವು ಟ್ರೀಟ್ಮೆಂಟ್ ಮಾಡಿಸಿ. ವಿರೇಚನ ಅಂತ ಹೇಳಿದ್ರೆ ಪರ್ಗೇಷನ್, ಲೂಸ್ ಮೋಷನ್ ಕೊಡ್ತೀವಿ ಟ್ರೀಟ್ಮೆಂಟ್ ಗೆ ಪಿತ್ತಜ ಡಿಸೀಸಸ್ ಗಳಿಗೆ. ಏನು ಥರ್ಡ್ ಒನ್ ಬಸ್ತಿ ಅಂದ್ರೆ ಎನಿಮಾ ಟ್ರೀಟ್ಮೆಂಟ್. ಎಲ್ಲ ವಾತಜ ಯಾವ್ಯಾವ ಕಾಯಿಲೆಗಳಿದೆ ಅದಕ್ಕೆಲ್ಲ ಬಸ್ತಿ ಅಂತ ಟ್ರೀಟ್ಮೆಂಟ್. 4ನೇದ್ದು ನಸ್ಯ, ಮೂಗಿಗೆ ಆಯಿಲ್ ಮೆಡಿಕಮೆಂಟ್ಸ್ ಹಾಕ್ತಿವಿ. ಇದು ಕತ್ತಿನ ಮೇಲಿರುವಂತ ಈಗ ಕಂಟಿನ್ಯೂಸ್ ವರ್ಷಗಟ್ಲೆ ತಲೆನೋವು ಅಥವಾ ನಿದ್ರೆ ಬರದಿರುವುದು, ಈ ತರ ಹಂಡ್ರೆಡ್ಸ್ ಆಫ್ ಡಿಸೀಸ್ಗೆ ನಸ್ಯ ಅಂತ ಒಂದು ಟ್ರೀಟ್ಮೆಂಟ್ ಮಾಡ್ತೀವಿ. ಇನ್ನು ರಕ್ತ ಮೋಕ್ಷಣ ಅಂತ ಹೇಳುವಂತದ್ದು 5ನೇದ್ದು, ಅದು ಬ್ಲಡ್ ಲೆಟ್ಟಿಂಗ್, ಬಾಡಿಯಿಂದ ಸ್ವಲ್ಪ ಬ್ಲಡ್ ಅನ್ನು ಹೊರಗೆ ತೆಗಿತೇವೆ. ಟಾಕ್ಸಿಕ್ ಬ್ಲಡ್, ಇಂಪ್ಯೂರ್ ಬ್ಲಡ್ ವಿ ಎಲಿಮಿನೇಟ್. ಸೊ ದೀಸ್ ಆರ್ ದ 5 ಪಂಚಕರ್ಮ. ಇದರ ಜೊತೆಗೆ ಮತ್ತೆ ಒಂದು 70-80-100 ಥೆರಪಿಗಳಿದೆ. ಆಯಿಲ್ ಮಸಾಜು, ಅಭ್ಯಂಗ, ಶಿರೋಧಾರ, ಶಿರೋಪಿಚು, ಶಿರೋಬಸ್ತಿ, ಉದ್ವರ್ತನ, ಲೇಪ, ಆತರ ಕಷಾಯ ಸೇಕ, ಧಾನ್ಯಾಂಬ್ಲ ಸೇಕ, ಈ ತರ ಮತ್ತೆ ಒಂದು 100 ಉಪಕಲ್ಪಗಳು ಇದೆ.
ಮೇಡಮ್ ನಮಸ್ಕಾರ.
ಹೇಳಿ ಸರ್.
ನೀವು ಡೈಲಿ ಗೀ ತಿನ್ನಬಹುದು ಒಳ್ಳೆಯದು ಅಂತ ಹೇಳಿದ್ರಿ, ಆದ್ರೆ ಅದರಲ್ಲಿ ಮ್ಯಾಕ್ಸಿಮಮ್ ಸ್ಯಾಚುರೇಟೆಡ್ ಫ್ಯಾಟಿ ಇರ್ತದಲ್ಲ, ಅದು ಯಾವ ತರ ಹೆಲ್ಪ್ ಆಗುತ್ತೆ ಮತ್ತೆ ಸ್ವಲ್ಪ ಹೇಳ್ತೀರಾ
ಸರ್? ಆಕ್ಚುಲಿ ಗೀಯಲ್ಲಿ ನಿಮ್ಗೆ ಪೂಫಾ ವ್ಯಾಲ್ಯೂ ಹೇಳೋದು ಕಡಿಮೆನೇ ಇದೆ ಕಂಪೇರ್ಡ್ ಟು ಪೂಫಾ ಅಂದ್ರೆ ಪಾಲಿ ಅನ್ಸ್ಯಾಚುರೇಟೆಡ್ ಫ್ಯಾಟಿ ಆಸಿಡ್ ವ್ಯಾಲ್ಯೂ. ಸೊ ಈ ತರ ನಿಮ್ಗೆ ಬೇರೆ ಕಂಪೇರ್ಡ್ ಟು ನಿಮ್ಗೆ ಸನ್ಫ್ಲವರ್ ಆಯಿಲ್ ಇರ್ಲಿ ಅಥವಾ ಲೈಕ್ ಕಡ್ಲೆಕಾಯಿ ಎಣ್ಣೆ ಇರ್ಲಿ, ಯಾವುದೇ ಇರ್ಲಿ, ಸೊ ಅದಕ್ಕೆ ಕಂಪೇರ್ ಮಾಡಿದ್ರೆ ನೀವು ಘೃತದಲ್ಲಿ ಅಷ್ಟೊಂದು ನಿಮ್ಗೆ ಲಿಪಿಡ್ಸ್ ಗಳು ಅಂದ್ರೆ ಬಾಡಿಗೆ ಹಾರ್ಮ್ ಮಾಡುವಂತದ್ದು, ಅಂದ್ರೆ ನಿಮ್ಗೆ ಎಲ್ ಡಿ ಎಲ್ ಅನ್ನು ಜಾಸ್ತಿ ಮಾಡುವಂತ ಲಿಪಿಡ್ಸ್ ಗಳು ನಿಮ್ಮ ಘೃತದಲ್ಲಿ ಇಲ್ಲ. ಮತ್ತೆ ಇನ್ನೊಂದು ಏನಂದ್ರೆ ನೀವು ಘೃತ ಅಥವಾ ತುಪ್ಪ ಎಲ್ಲಿಂದ ಬಳಸ್ಕೊಂಡ್ರಿ ಅದನ್ನ ನೀವು ಈ ತುಪ್ಪವನ್ನೇ ಎಣ್ಣೆ ಹಾಕಿ ಅದಕ್ಕೆ ತುಪ್ಪದ ಸ್ಮೆಲ್ ಇರುವ ಕೆಮಿಕಲ್ ಅನ್ನ ಹಾಕಿ ತುಪ್ಪ ಅಂತ ಮಾರ್ಕೆಟ್ ಅಲ್ಲಿ ಮಾರಾಟ ಮಾಡ್ತಾರೆ, ಅಥವಾ ಪೊಟ್ಯಾಟೊ ಸ್ಮ್ಯಾಶ್ ಮಾಡಿ ತರಿ ತುಪ್ಪ ಅಂತ ಹೇಳಿ ತುಪ್ಪ ನೇಮಲ್ಲಿ ಕೊಡ್ತಾರೆ. ಸೊ ಈ ತರ ಐ ಆಮ್ ನಾಟ್ ಟಾಕಿಂಗ್ ಅಬೌಟ್ ಆಲ್ ಸಚ್ ಗೀಸ್. ಸೊ ನೀವು ಯು ಶುಡ್ ಮೇಕ್ ಶೋರ್ ದಟ್ ನೀವೇನ್ ಗೀ ನಿಮ್ಗೆ ಸಿಗುತ್ತೋ ಅದು ಪ್ಯೂರೆಸ್ಟ್ ಅಂತ ಹೇಳಿ ಆದ್ರೆ ಇಟ್ ನೆವರ್ ಕಾಸಸ್ ಡಿಸ್ಲಿಪಿಡೇಮಿಯಾ. ಅಂದ್ರೆ ಬಾಡಿಯಲ್ಲಿ ಲಿಪಿಡ್ಸ್, ನೀವು ಕೊಲೆಸ್ಟ್ರಾಲು, ಟ್ರೈಗ್ಲಿಸರೈಡ್ಸ್, LDL, HDL ನಾವೆಲ್ಲ ಸ್ಟಡಿ ಮಾಡಿದ್ವಿ. ಸೋ ಮೆನಿ ರಿಸರ್ಚಸ್ ಹ್ಯಾವ್ ಕಂಡಕ್ಟೆಡ್ ಬೈ ಗಿವಿಂಗ್ ಗೀ, ಏನು ಶಮನ ರೂಪದಲ್ಲಿ ಆಗ್ಲಿ ಶೋಧನ ರೂಪದಲ್ಲಿ ಆಗ್ಲಿ ತುಪ್ಪ ಕೊಟ್ಟು ಎವರಿ ಡೈಲಿ ಬೇಸಿಸ್ ಅಲ್ಲಿ ತುಪ್ಪ ಕೊಟ್ಟು ವರ್ಷಗಟ್ಲೆ ಆದ್ಮೇಲೆ ನೀವು ಲಿಪಿಡ್ಸ್ ನೋಡಿದ್ರೆ ಪರ್ಫೆಕ್ಟ್ ಆಗಿ ನಾರ್ಮಲ್, ಪ್ರೊವೈಡೆಡ್ ದ ಗೀ ಶುಡ್ ಬಿ ದ ಪ್ಯೂರೆಸ್ಟ್.
ಆದ್ರೆ ಅದ್ರಲ್ಲಿ ಸ್ಯಾಚುರೇಟೆಡ್ ಫ್ಯಾಟ್ ಜಾಸ್ತಿ ಇರುತ್ತಲ್ಲ ಮೇಡಮ್, ಅದು ಕೇಳಿದ್ವಿ. ಅದು ಕಾರ್ಡಿಯೋವ್ಯಾಸ್ಕ್ಯುಲರ್ ಡಿಸೀಸಸ್ ಜಾಸ್ತಿ ಬಂದ್ಬಿಡ್ತು
ಆಕ್ಚುಲಿ
ಅದರಿಂದ.
ಸ್ಯಾಚುರೇಟೆಡ್ ಪಾಲಿ ಆಸಿಡ್ಸ್ ಏನಿದೆ ಜಾಸ್ತಿ ಇರುತ್ತೆ, ಬಟ್ ದಟ್ ಡಸಂಟ್ ಕಾಸ್ ಡ್ಯಾಮೇಜ್. ವೈ? ಬಿಕಾಸ್ ಅದರಲ್ಲಿ ಏನಂತ ಹೇಳಿದ್ರೆ ಅದರಿಂದಾಗಿ ನಿಮ್ಗೆ ಎಥೆರೋಸ್ಕ್ಲಿರೋಸಿಸ್ ಆಗಲ್ಲ. ಎಥೆರೋಸ್ಕ್ಲಿರೋಸಿಸ್ ಅಂದ್ರೆ ವ್ಯಾಸ್ಕ್ಯುಲರ್ ಬ್ಲಾಕ್ಸ್ ಆಗಲ್ಲ. ಅದರಿಂದ ಎಲ್ಲ ಎವರಿ ನರ್ವ್ ಗೆಟ್ಸ್ ರೀಜನರೇಟೆಡ್. ಸೊ ತುಪ್ಪವನ್ನು ನೀವು ನೋಡಿ, ನಾವು ವಿ ಹ್ಯಾವ್ ಗಿವನ್ ಇಟ್ ಫಾರ್ 1 month 2 months. ಎಷ್ಟಂದ್ರೆ 30 ml ಬೆಳಿಗ್ಗೆ 30 ml ಸಂಜೆ ಶಮನ ಡೋಸೇಜ್ ಅಲ್ಲಿ ಕೊಟ್ಟು 1 ತಿಂಗಳು 2 ತಿಂಗಳು ಕೊಟ್ಟು ಮತ್ತೆ ಲಿಪಿಡ್ ಪ್ರೊಫೈಲ್ ನಾವು ವಿ ಹ್ಯಾವ್ ರಿಪೀಟೆಡ್ ಅಂಡ್ ವಿ ಹ್ಯಾವ್ ಸೀನ್ ದಟ್ ದರ್ ಇಸ್ ನೋ abnormality or no increase in the triglycerides ಇದೆಲ್ಲ. ಸೊ ದೇ ಹ್ಯಾವ್ ಸಮ್ ಕಾಂಬಿನೇಷನ್ ಅಂಡ್ ಯು ಕ್ಯಾನ್ ಸಿ ದಟ್ ದೋಸ್ ಪೂಫಾ ಏನಿದೆ ಅಲ್ಲ, ಪಾಲಿ ಅನ್ಸ್ಯಾಚುರೇಟೆಡ್ ಆರ್ ಸ್ಯಾಚುರೇಟೆಡ್ ಫ್ಯಾಟಿ ಆಸಿಡ್ಸ್ ಏನಿದೆ, ಸೊ ದಟ್ ವಿಲ್ ಬಿ ಮೋರ್ ಇಫ್ ಇಟ್ ಈಸ್ ನಾಟ್ ಫ್ರಮ್ ದ ಕೌ. ಬಫೆಲೋಸ್ ಇರುತ್ತೆ ಅದರದ್ದು ಇದರಿಂದ ತಗೊಂಡಿರೋದು. ಸೊ ಆ ತರ ಎಲ್ಲ ಆದ್ರೆ ಅದರಲ್ಲಿ ಜಾಸ್ತಿ ಇರುತ್ತೆ, ಬಟ್ ದಟ್ ಈಸ್ ನಾಟ್ ಅಡ್ವೈಸ್ಡ್. ಓನ್ಲಿ ಗೋಘೃತ ಈಸ್ ಅಡ್ವೈಸ್ಡ್.
ಮೇಡಮ್, ಈಗ ಎಳ್ಳೆಣ್ಣೆ ಆಗಿರ್ಬೋದು, ಹುಚ್ಚೆಳ್ಳೆಣ್ಣೆ ಆಗಿರ್ಬೋದು, ಇವನ್ನು ಕೂಡ ಪರ್ಯಾಯವಾಗಿ ಬಳಕೆ ಮಾಡ್ಕೊಳ್ಬಹುದಾ? ಯಾಕಂದ್ರೆ ನಮ್ಮ ಪೂರ್ವಜರು ಅಡುಗೆ ಮಾಡುವಂತ ಟೈಮಲ್ಲಿ ಸಾಂಬಾರ್ಗಳಿಗೆ ಇದನ್ನ ಒಗ್ಗರಣೆ ಹಾಕೋದ್ರ ಮೂಲಕ ಸಾರಿನ ಟೇಸ್ಟ್ ಅನ್ನ ಹೆಚ್ಚಿಸ್ತಾ ಇದ್ರು ಅವತ್ತಿನ ಕಾಲಕ್ಕೆ.
ಸರಿ, ಎಳ್ಳೆಣ್ಣೆ ಯೂಸ್ ಮಾಡ್ಬೋದು. ಎಳ್ಳೆಣ್ಣೆನೆ ನಮ್ಮ ಎಲ್ಲಾ ಎಣ್ಣೆಗಳಿಗೆ ಬೇಸ್. ನಮ್ಮ ಆಯುರ್ವೇದದಲ್ಲಿ ತೈಲ ಅಂತ ಏನ್ ರೆಡಿ ಮಾಡ್ತೀವಲ್ಲ ಅದೆಲ್ಲ ಎಳ್ಳೆಣ್ಣೆ ಬೇಸ್ಟೇ ತಯಾರಾಗೋದು.
ಹೌದು,
ಗೊತ್ತಾಯ್ತಲ್ಲ? ಸೊ ಎಳ್ಳೆಣ್ಣೆಯನ್ನು ಯೂಸ್ ಮಾಡ್ಬೋದು, ಆದ್ರೆ ಅತಿಯಾಗಿ ಯೂಸ್ ಮಾಡೋದಿಲ್ಲ. ಅದು ತುಂಬಾ ಹೀಟ್, ಕಂಪ್ಯಾರಿಟಿವ್ಲಿ ಸ್ವಲ್ಪ ಸ್ವಲ್ಪನೇ ಬೆಳೆಸ್ಕೊಳ್ಬೇಕು, ಅದು ಬಾಡಿಗೆ ಹೀಟ್ ಆಗುತ್ತೆ. ಅದರ ಬದಲು ಕೊಬ್ಬರಿ ಎಣ್ಣೆ ಯೂಸ್ ಮಾಡ್ಬೋದು. ಕೊಬ್ಬರಿ ಎಣ್ಣೆ ತುಂಬಾ ಒಳ್ಳೆಯದು.
ಅಡಿಗೆಗೆ ಯೂಸ್ ಮಾಡ್ಬೋದಾ ಮೇಡಮ್ ಅದು?
ಕೊಬ್ಬರಿ ಎಣ್ಣೆನೆ ಮಾಡ್ಬೇಕು. ಸೊ ಎಲ್ಲೆಲ್ಲಿ ಕೊಬ್ಬರಿ ಎಣ್ಣೆ ಯೂಸ್ ಮಾಡ್ತೀರಾ, ಈಗ ನೀವು ಕೇರಳದಲ್ಲಿ ತುಂಬಾ ಕೊಬ್ಬರಿ ಎಣ್ಣೆ ಯೂಸ್ ಮಾಡ್ತಾರೆ. ಸರ್ವೆ ಆಗಿದೆ ಅಲ್ಲಿ ಕಾರ್ಡಿಯಾಕ್ ಅಟ್ಯಾಕ್ಸ್ ಎಲ್ಲ ನಮ್ ಕರ್ನಾಟಕಕ್ಕಿಂತಲೂ ಕಡಿಮೆ ಅಲ್ಲಿ, ಬಿಕಾಸ್ ದೇ ಯೂಸ್ ಕೋಕೋನಟ್ ಆಯಿಲ್.
ಹೌದು. ಓಕೆ ಮೇಡಮ್, ಈವರೆಗೂ ಫಂಡಮೆಂಟಲ್ ಆಸ್ಪೆಕ್ಟ್ಸ್ ಆಫ್ ಆಯುರ್ವೇದ ಅನ್ನುವಂತಹ ವಿಚಾರವನ್ನ ಕುರಿತು ಬಹಳ ಸುದೀರ್ಘವಾಗಿ ಚರ್ಚಾತ್ಮಕವಾಗಿ ಎಲ್ಲರ ಜೊತೆ ಎಲ್ಲಾ ಕೇಳಿದಂತಹ ಪ್ರಶ್ನೆಗಳಿಗೆ ಅತ್ಯಂತ ಸಾವಧಾನ ಚಿತ್ರದಿಂದ ಉತ್ತರಗಳನ್ನ ನೀಡೋದ್ರ ಮೂಲಕ ಬಹಳ ಅತ್ಯಂತ ಮಾಹಿತಿಯುಕ್ತ ಒಂದು ಸೆಷನ್ ಅನ್ನ ನಮ್ಗೆ ಇವರೆಗೂ ನಡೆಸ್ಕೊಟ್ಟಂತಹ ವೀಣಾ ಜಿ ರಾವ್ ಮೇಡಮ್ ಅವ್ರಿಗೆ HRDC ಮೈಸೂರು ಅವರ ವತಿಯಿಂದ ಹಾಗೂ ಎಲ್ಲಾ ಶಿಬಿರಾರ್ಥಿಗಳ ಪರವಾಗಿ ಹೃದಯಪೂರ್ವಕ ನಮನಗಳನ್ನ ಈ ಮೂಲಕ ಸಲ್ಲಿಸ್ತಾ ಇದೀವಿ. ಥ್ಯಾಂಕ್ ಯು ಸೋ ಮಚ್ ಮೇಡಮ್.
ಥ್ಯಾಂಕ್ ಯು ಸರ್. ಥ್ಯಾಂಕ್ ಯು.
Thank you so much.
Thank you.
Thank you, madam.